Hello and welcome to Talk Truth. My name is Corey Huntsberger. I've got my father, Alan Huntsberger, in the studio with me. And Dad, we're going to start off with our foundational verse because after this conversation, we're going to need it. It says, the earth and everything in it, the world and its inhabitants belong to the Lord. For he laid its foundation on the seas and established it on the rivers. Psalm 24, 1 and 2. Everything belongs to the Lord. That's you, that's me, that's our kids, that's everything, right, Dad?
Yes. And of course, we believe that 100%. The caveat to that is that God allows us to make a choice. And there are people in this world that choose not to follow God, not to believe in God, not to have anything to do with God. Consequently, they come up with their own doctrine, their own beliefs, their own system, and it clashes with the system that God has established.
For sure.
And that's really where we find ourselves today.
Yeah, especially when you talk about gender. He made male and female, and now we've got all different kinds of genders, Alan. You and I don't even know how to name them all. There's so many things going on. We wanted to bring that in as a foundation because the conversation we're going to have is something that is really affecting all nations across the globe. And we're excited to have our guest on. We're going to bring her on right now. Her name is Dr. Melanie, and Dr. Melanie, I hope I get this right, Crites-Bachert. Is that correct?
Bachert, yes, double German.
Well, Huntsberger, everyone messes that up too. You know, it's all always our German names. Dr. Melanie, thank you so much for being on the show. You have an incredible, extensive career in the medical world. I'm going to go ahead and let you give us a little bit of your background, just so our viewers can get to know who you are a little better.
Thank you so much for the opportunity. So, yes, as you said, I'm Melanie Crites-Bachert. I am a fellowship-trained pelvic reconstructive surgeon. So what that means is I'm a urologist by trade, but I went on to do further training in a subspecialty of urology, just specifically dealing with rebuilding the pelvis and taking care of issues in the pelvis that need to be addressed. For instance, men with stricture disease that have developed a narrowing in the urethra from scar tissue, and that needs to be excised and refashioned and reconstructed. That's everything from taking care of that sort of thing to fistulas, which is a connection between one organ and another. So typically the bladder or urethra and the colon, or another organ system such as the skin, related to, generally we see that related to having had the prostate out and going through radiation treatments for prostate cancer. But it also encompasses urinary incontinence, so treating ladies and men who have urinary incontinence and reinforcing the urethra or taking care of dropped bladders and uteruses and rebuilding the vagina that has basically protruded out of the body. So it encompasses the entire gamut of pelvic reconstructive surgery, anything dealing with the pelvis that is damaged and needs to be rebuilt.
Yeah. Well, I'm sure people are wondering, why you guys haven't Dr. Melanie on? Is it because something's wrong with Alan's pelvic? No, there's nothing wrong with us in that matter. The reason why we had you on is because you're an expert in your field, and you are qualified and fearless to speak on the topic of medical mutilation. That's the conversation that we're having today. Although you're highly qualified and trained to do those surgeries, you have chosen not to perform gender reassignment procedures. Fantastic. That is really what we want to focus on. And I wanted to ask you, is this rare in your field? Do you feel like you're a lone wolf? Are there other doctors in your field as well speaking out and choosing not to do it? Or do you feel like it's lonely out there?
So it is kind of lonely because the majority of my profession have been perverted by greed, and they will toe the mark for whatever facility they are beholden to. So whoever is writing their paychecks or who they're beholden to. I actually was independent. I was an independent practitioner, so I had my own practice. I could do what I wanted to do, or not what I wanted to do, sort of thing. So basically, I could choose, and I knew that from very early on in my career that I wanted to be an independent provider. I didn't want somebody telling me what to do because, as we know, we've seen historically in the past, whenever you are beholden to someone, you end up becoming compromised. And if you're not compromised, you end up having a very tough existence. And I did not want that medically. So I built up the Premier Pelvic Health Center in Portland, Oregon, and took care of all of those pelvic health concerns. I was the go-to person for the complicated pelvic health concerns in the community that my colleagues either weren't equipped to take care of or didn't feel competent enough to take care of those situations. So I chose not to get into the realm of reassignment, gender reassignment surgery. Back in the day, before there were fellowships, so a subspecialty, again, it's a further subspecialty of pelvic reconstruction that is now gender reassignment surgery. And those fellowships have been around now for about 6-7 years. So less than 10 years. But it used to be that back in the day, if somebody were wanting to be someone who took on gender reassignment, the fellowship that I did is the one that you would do, because it was the general pelvic reconstructive, and then you worked with somebody out in the community, or you found somebody who had been doing those surgeries for a while, and you worked with them for a little bit until you became competent enough to do those surgeries on your own.
Mm.
We've been interviewing some young people that have had this surgery, and of course their stories are tragic. There's really no successful story, and the stories coming out, that basically what it seems to be, and you kind of hit it on the head about greed. But it seems to be that all this surgery that they're trying to change genders and stuff like that is more experimental than anything else.
In some ways, it is, especially on minors. And Corey, back to your original question, do I feel like a lone wolf? All of that to say, I wasn't beholden to a hospital system simply because of that greed, of that greed factor. There are a few surgeons, a plastic surgeon and another urologist that I know of, who do not agree with this. The plastic surgeon is actually speaking out. The other urologist is beholden to a hospital system, and certainly can't. But you are exactly correct, Alan. When it comes to surgeries like this, these are surgeries that are typically performed on adults who are fully grown. They've gone through puberty. They've gone through all of their growing processes. Their brains are developed. Their bodies are developed, at least fully, to the point that they're going to be. So this is something that is relatively experimental, as I would consider calling it, because we're specifically speaking about children, and children who are not fully developed. Their brains are not fully developed. A human brain isn't fully developed until around the age of 23 to 25. And then bodies aren't fully developed, at least until 18, 20. I mean, how many kids do you know that are actually still growing, at the age of 17 and 18? Certainly not 5, 6, 7, 8, 9-year-old children who still have puberty to go through and bodily functions to develop. Nevertheless, just trying to figure out who they are and just trying to navigate the world as they grow, and going through those normal processes that we all had to go through.
Can you give us just like, have people come into your establishment and asked for this surgery? What is your explanation to them of why you're not able to do it, or you choose not
So
to do it?
I never really had somebody come in and ask me to do these surgeries. The biggest one that I had, and it was specifically because I went into a niche of treating pelvic organ prolapse and urinary incontinence, and that's fairly well what I specialized in, and how I advertised myself. But I would have patients come in and ask for orchiectomies. So boys coming in asking for me to cut their testicles off because they didn't want to be boys anymore. I just simply explained that is not something that I do in my practice unless it is something that is necessary because of a cancer situation, a testicular cancer, or something of that nature. But I do have horror stories of being on call and having to take care of patients who did some very unusual things to their bodies in the name of not wanting to be their biological sex.
Yeah, can we go into some of the medical complications on this whole reconstruction of, I mean, to people like Alan and I, we don't understand it. You know what I mean? It sounds crazy to us. And Alan's correct. We've interviewed other people, talked to other people, and no one's happy. You know what I mean? They're still never happy. And they always use hey, we have to go along with this, or, would you rather have a dead son or an alive daughter? They use all these mind tricks. We saw it during COVID. Hey, if you don't take this, you're going to kill my grandma. I mean, they use all this to make you feel guilty and sad and ashamed that you're even asking questions. But I don't know where common sense went. But we're talking about children here. Everybody knows that their mind is not developed until, like you said, 23 to 25 years of age. But yet we're allowing them to make these kinds of crazy decisions. We won't even let them get tattoos. They can't even, drive a car. They can't even, all these things they can't do. But yeah, it's okay if they want to completely mutilate their body. What are some of the complications in your world when people go through with this? What happens?
It's generally twofold. So if a person can nip it in the bud early when there's basically social indoctrination and social transitioning, that's where they essentially come out to the world that they are transgender, and they start using pronouns in schools and things such as that. If you can nip it in the bud at that stage, it's generally completely reversible, because at that point in time, the only thing that has been manipulated is the mind. Once you start getting into hormonal manipulation, then you start down the road of irreversible consequences. And once you get to surgery, you're done. There is no going back from that. Once you get to surgery and the surgery is performed, and we're talking about things not just breast surgery and mastectomies, because yes, you can undergo surgery and have breast implants and rebuild the breasts. It's still not a biological, normally functioning organ as it was before. But we're talking about things like reconstructing the genitals. Once you take a normal, healthy tissue and you mutilate it, which is exactly what it is. When you disrupt normal, healthy tissue for the sake of cosmesis, which is all this is. It is just changing an outward appearance. It is not changing your DNA. It is not changing your chromosomes. So once you deconstruct normal, healthy tissue and you fashion something else, that something else is completely artificial, and it is not going to function the way that biological, if you were born with a vagina, an artificial vagina creating a vagina is not going to function in the same way that a God-given vagina would. The same thing with male anatomy. You can be a biological female, and we can deconstruct your vagina and we can rebuild something artificial in the way of a penis, but it will never function the way God intended a biological male to function. There will always have to be some sort of enhancement, which then subjects you to further surgery because that's generally a mechanical device. And when you talk about mechanical devices, much like heart pacemakers and heart valves and things like that, at some point in time, all or part of that device is going to need to be replaced. Not to mention if there are complications with the original surgery. So God forbid you have complications with the original surgery, you may not even get to the point of having a prosthetic implanted, because once you go through surgery and once you take a step back and start hormonal manipulation, you're a patient for life. And that's where the greed comes in, because this sort of hormonal manipulation creates patients for life. Once you start that hormonal manipulation, even if you decide to go back to your original God-given form, you're going to be on hormonal enhancements to supplement what you lost going through that transition to begin with. So if you were a male and you tried to become a female and you go back, you are generally always going to be on testosterone because you will have killed your testosterone stores or significantly depleted them such that you're not going to have your normal amounts of testosterone that God intended. So that's where the greed comes in. The hormonal manipulation and the surgeries basically create patients for life.
Wow.
Right.
Then when
We've
you
heard
further
that.
talk about children
Yeah.
and you're manipulating children's bodies when they aren't even fully developed yet,
Right.
therein lies more surgeries because you're altering a body that's still growing. So they haven't even grown into their bodies yet. So you're already manipulating something that's not fully grown and is going to continue to grow even after the alteration.
Right. I don't even
And
like
all
going to
this-
the hospital and
this.
getting a needle for blood. I don't. I don't even understand how people could go through all this. Sorry, go ahead, Alan. What were you going to say?
Well, we've heard this before that once you start this, you're on chemicals the rest of your life.
Nobody tells children this, and children certainly can't make these decisions. They don't know the ramifications at the age of 8, 9, 10 years old that they may never have their own biological children. And they generally don't even know what sex is at that point. At least I was worried, about being a kid. I wasn't worried about those things when I was that age. I guess, children are finding out things earlier and earlier these days, and generally these conversations are not being had between the parents and the children. The children are learning these things, in other ways. So they're generally getting misinformation. So nobody is telling these children. And just like physicians, we take an oath to do no harm, but physicians will tell children, oh, puberty blockers, they're completely reversible. No, they're not. No, they're not. These puberty blockers, just to put this into perspective, these puberty blockers that are given to children are the same exact medications that we give to men with prostate cancer. They've not been studied in children. So we know what happens to adult men and women when they're given these medications. We don't know what the effect on children are. There are no long-term studies to show what happens and to be able to tell children and adults truly what's going to happen.
This, are you shocked that we're here having this kind of conversation in today's world? I'm sure when you were growing up wanting to be a doctor, a surgeon as a little girl, you never thought this would be the kind of conversations you would be having. Are you shocked that we are here, and are you seeing a move to change this? Is it getting worse? Is it getting better? What are you seeing?
Well, I'm not shocked that this is happening because I've read the book and I know how the book ends. So I know that these things are just, biblical, and, there are going to be wars and rumors of wars, and people will hear the truth and they will not believe. I mean, we know this. This is in the book. So having said that, am I shocked by it? No, not really. Did I ever think that I would have these conversations? Yeah, probably not. Um, do I see a tide turning? Yes, I do, because we are getting the information out there, but it's a matter of those with ears, let them hear. And if they don't have ears to hear, they're going to tune you out anyway. So the best that we can do at this point is spread the gospel, spread the truth as we know it, and just try to get the truth out there and take care of our patients. At least for me as a doctor, taking care of a patient is just that, caring for them and giving them the truthful information as I learned it in medical school and even before. I'm an old farm kid, so I learned biology on the farm. So I learned a bit about medicine and biological functions before I ever went to medical school. So praise God for that. But yeah, it's spreading truth that I know it to be, and taking care of my patients and giving them the information that I would want as a patient.
Yeah. Do you have information or books or whatever that we can direct families to? Because it's happening everywhere, and it may not be their child, but it be one of their child's friends that are thinking about it. What resources are there that we can forward people to that they could check out and at least equip themselves a little better to have the conversation if they know of someone who's going through this or wants to go through this?
There is a book by a social worker by the name of Pamela Garfield Yeager. That is more of a book for parents trying to navigate these social things at schools and in groups. So it's a very easy read. That's a wonderful resource. Dr. Miriam Grossman's book, Lost in Transnation, is a fabulous resource for for parents approaching their children and having these conversations with their children if their children come home and say, hey, I think I'm something different. There is also a group, Association for Mental Health Professionals.org. I do know the founder of this, and this is a non-woke, conservative, God-fearing group all over the nation and in Canada. In fact, I was just on a Zoom with them a few weeks ago with some folks, some counselors from Canada. So that's a huge network of resources. If you need a counselor or need to find a counselor that's not woke, to be able to take your children to, conservativecounselors.com is also an offshoot of Association for Mental Health Professionals. So I recommend all of these, as well as donoharmmedicine.org. So that is a website that has a wealth of resources of physicians and counselors. So it's basically a group of professionals that have come together and providing truthful information.
Yeah, that's awesome.
I noticed in your information that we got sent that you dealt a lot with the unconstitutional mandates and everything else that happened with COVID-19. We got about a minute and a half left. Do you believe that this COVID-19 was really something like a military exercise that was put on the people and had alternative goals and directives other than just medical?
So I am purely speaking from opinion. I do want to say that I don't want it to be construed that I'm, giving facts. But personally, I do believe this. In fact, 30 years ago, before my daddy died, my daddy predicted something like COVID would happen, and he told me to. He was very, very good at seeing the writing on the wall. So as soon as COVID happened, my spidey senses went up, and sure enough, it was exactly exactly what my wise father told me to watch out for. And knowing what I know about things, governmental conspiracy, they're not conspiracy theories. We know things like MK Ultra happened, and things like that are still going on. So yes, I do believe that that's exactly what it was. It was orchestrated to see how far they, whoever you believe they to be,
Yeah.
to see how far they could push things and manipulate the masses.
And do you think that the general public is wiser now and they won't have success the next time around?
I don't. I think that there are masses that have learned. There are some of those folks that have woken up, and then the rest of us that knew from the beginning that it was orchestrated. I do believe that there are folks that have have woken up, but no, I do believe it will happen again, and I do believe that people will fall for it again, hook, line, and sinker.
Wow. We really appreciate you coming on the show. We're so grateful for you. Thank you for your bravery to choose not to do those kinds of surgeries and to speak up against those kinds of surgeries. Mutilation, I think that's the perfect word to use. And you know what? It's always the first person through the wall that gets bloody. I know more doctors are going to back you up and have support. And hopefully they do what you did. Stand up and say, no, these kids don't know what they're doing and what they're signing up for, so we're not going to do it. Appreciate you. We'll definitely have you back.
Thank you so much for the opportunity. It's been a pleasure.
Well, that was an interesting conversation, huh, Dad? Isn't
Yes,
it?
it was.
Can I just say, it's so awesome to see God rising up people, and we're finding them: doctors, scientists, lawyers, politicians, teachers, principals, headmasters at universities and schools. He's right, housewives, what I mean? Just regular people. Just God is rising people up to speak the truth, to stand for freedom, to say no when they know they're going to get persecuted, they know they're going to get shamed, they know they're going to get punished, but put in a process where the process is the punishment. It is so exciting to see God move and work. I don't know, it makes me excited. We definitely have to have her back, right?
Amen. Yeah,
Amen.
especially because she used to be called a tomboy.
A tomboy. Anyone remember that term? No one talks about a tomboy anymore, but I grew up with tomboys. Yeah, absolutely. Hey, Dad, we're giving away a free booklet called The Living Stone, A Journey in Transformation. It's yours absolutely free. It's going to help you in your walk and relationship with Jesus. It doesn't cost anything. Go to our website, gotalktruth.com, click on resources, fill out the form. We'll send it to you in the mail. If you want to help support our mission, we are viewer supported. You can go to our website, gotalktruth.com, click on the donate button. If you'd like to do it through the mail, you can. You can make a check payable to Heritage Christian Ministries Association and send it to 246 Stewart Green Southwest, Suite 3260, Calgary, Alberta, T3H 3C8. If you like prayer, you can call our toll-free line, 1-800-445-3450 in the U.S., or you can call 1-800-915-0056 if you're in Canada. All right, Dad, we're out of time. We'll see you guys later.
Love you.